Okay, good afternoon, everyone. Thank you for joining us. I am Brenda Rourke, and this is Gail. We're both we're both members of the team in the Center for Insurance Policy and Research at the NAIC. And today, we're going to go through what we're calling the Research Toolkit. So just a little overview of our session. I'm actually going to get up and sit behind the podium. A little overview of our session. So we're going to go through 4 different approaches to doing research. So I'll talk a little bit about survey research and experimental research, and then Gail will talk a little bit about observational data and qualitative research. The hope is that after our presentation that you'll be able to kind of compare these different methods and approaches and have a better understanding of research that you might be looking at, whether that's coming from a report from a different agency, or if you're looking at academic research, so looking at actual journal articles that are coming from academic journals. And then sort of in tandem with that, once you have a better understanding of the different approaches that they've taken and the types of questions that they can answer with that research, you'll be then able to use that in your own work to kind of inform some of the decisions that you might be making. So high-level overview, 2 of the things that you sort of want to focus on when we're looking at research is, first of all, how did they design the research? So this is really, what approach did they take? What kind of data were they trying to collect? That's really what this question asks. And so we can do that quantitatively. So we're looking to gather information using numbers. And we'll look at a couple of different approaches to do that. And then qualitatively, so looking at text-based responses. So any of those open-ended questions, or if people are using focus groups or interviews, that's qualitative data. And then, of course, you can take both of those methods and put them together and have a mixed methods approach. And some of the work that I've done more recently, since coming to the NAIC, has been a mixed method approach. So we'll talk a little bit about that today. So my background, I'm a communication research scientist. I earned my PhD from the University of Connecticut in communication research. And so a lot of what I'm doing, the research that I'm going to go through today, that I'm working on at CIPR, or with CIPR, is consumer-focused communication research. I think the benefit of doing this type of research and what we're getting from this type of research is a better understanding of consumers' attitudes. Sometimes we can get to places of understanding how those attitudes are predicting behaviors and looking at actual choices that consumers are making. And for all of you in the room, this type of research, I think, really helps us to drive communication, or drive communication that when we're sending it out to consumers is more research-based. And that's, important in the insurance industry. So when it comes to survey research, we're looking at this as a method of gathering information from really large groups. So when you want to know something from a really large population of people, this is a great way to sort of tackle gathering that information. And you've probably looked through research reports that have used this particular design or research methodology. And then second to that is, not only does it enable you to gather information from large populations, but you can also do that both quantitatively and qualitatively. So we can do this in a way where we're gathering information that's just going to give us a numeric description or some trends. And that's an example in question 1. So if you're looking at question 1 on the screen here, right, we're asking just what types of insurance do you have? So I can kind of, send this survey out to a certain population of people and find out what different types of insurance they carry. I might be able to look at that by different demographic criteria if I wanted to. The second question is getting more at attitudes. How do I feel about a particular thing? So that's the second thing that we can do with some of this quantitative research, is get at attitudes. And here, actually, I was noticing this as I was going through the slides today. This is a question where I would have to reverse code this data. So you see how strongly agree is an A and strongly disagree is E. When we use this quantitatively to make inferences from the data, we want to kind of look at the question and what it's asking, and then code the question appropriately, right? So for this type of question, if we're asking somebody, is insurance valuable to me? I'm guessing that most of you in this room would want people to say that they strongly agree with that response. So we would want that to be our higher value. So the E being a 5, right? We would make that our strongly agree. Just something dorky as a researcher that I noticed as I was going through. And then the last question here is an example of what I was referring to as qualitative data. And so here we're asking people to just give us their thoughts or opinions on something. And Gail will go into this in more detail when she talks about her work, but here we're gathering open-ended responses, and then we're going to start looking for themes that come up within those responses. You've probably, if you haven't looked at this in a research report or an article, you may have interacted with survey data on your own, participating in a survey, right? There's a lot of companies now that are sending us these after we've interacted with them or used one of their products. So I mentioned that we work on research in the Center for Insurance Policy and Research. I know that's surprising given the name, but this is an example of one of the studies that I've been working on since I've joined CIPR, and it's survey-based research. And so here, the question was, how can we get to understand what are the predictors of an earthquake insurance uptake? And so one of the ways to approach this is to collect survey data. We put together a number of different variables that we think would be predicting insurance uptake, and we sent this out to, specifically, you're looking at the N size that you see here, or the number of people that we surveyed, is representative of just the folks in Missouri. But in 2022, this went out to all of the states that are part of what they call the Central US Earthquake Zone, or the CUSEC region. And we did a similar study in 2024. So you see 2022 and 2023 here, just Missouri. In 2022 and 2024, this has gone out to all the states in that CUSEC region. So the N size is much smaller. I think around 1,200 in 2022, and this year in 2024, we surveyed over 1,500 people. So some of the findings that we can gather or that we can glean from the data that we collected through this survey is looking at, we took all of these, and on an earlier slide, it showed you different research methods, right? How am I then going to analyze this data? When we have quantitative data, we can put these into complex models and look at what are the strongest predictors of earthquake insurance uptake. So here we looked at, if you have earthquake insurance, what predicts that you would have it? And these are the things that we found were the most significant in that model. One of them was talking to insurance agents, so people that had had conversations with their agent or an agent about earthquake insurance were more likely to have it. The second one was having sufficient information about earthquakes, right? Maybe not surprising, but important to know that people need to have what they believe to be a sufficient amount of information. And then talking to friends and family, knowing whether or not their friends and family are covered, maybe having those conversations about the coverage or the value that they see in that coverage is important. And then finally, we know that cost has an impact to varying degrees on whether or not someone's going to take up earthquake insurance. So next, this is probably my favorite area of research when it comes to the type of design and methodological approach, and that's experimental research. When it comes to experimental research, think about drug trials. That's kind of how you can kind of couch this to see it in its clearest light. And that is that when you're thinking about a drug trial, not everyone, when they're testing drugs, is going to get the actual drug itself. Some people are going to get the placebo so that they can compare the effect that that drug is having and then look at the differences between that and what we call the control group. And so this is my favorite type of design when it comes to research, because I want to see what happens when I manipulate something or change something and what the outcome might be. And I mentioned earlier that, I've started to do work when I started to do work in CIPR, that I did a mixed methods approach, and that's the first study that we're going to look at here. So this is my research design, my experimental research design, and here we have a couple of different things that we manipulated, if you will, or controlled for when we conducted this experiment. The first one is what you see here is placing survey respondents into a hypothetical context. For this study, we were looking at long-term care insurance and what type of decision consumers are making regarding their long-term care insurance policy when they're faced with premium increase letters. So what choice would they make? There's a host of reduced benefit options that they can choose from, or they can elect to take a premium increase. The problem with doing research with this particular population was, how do we get access to these people? If you don't already know, there are a very small number of people that carry this type of traditional standalone long-term care insurance that we were interested in. And so we had to come up with a way to replicate the experience of a policyholder. If I'm going to survey just the average person and ask them to answer questions about a long-term care insurance policy, then I need to make this kind of mirror the experience that I know policyholders are having. We met with a team of people to design this particular element of the research, and we know that a lot of people that have this type of insurance have gone through rate increases before. They're at a more advanced age, and so we kind of made those part of our context. We only assigned half of our participants to the context, and half of them did not get it, just to see what effect does that have, right? So thinking about that control versus the experimental group, if I gave you a prior rate increase, would you make a different decision than someone who hasn't received a notification for a rate increase before? The second thing that we manipulated, and you'll see that represented in the next two boxes here, is we took two different types of letters. There are very specific guidelines that states use when they're reviewing the letters that go out to consumers. And so we wanted to test some of those guidelines. Are they helping consumers to understand the type of choice that they have to make? And so we created two letters, one that followed the guidelines and principles, and then one where we took all of those elements that would have followed the guidelines and principles, we removed those elements from the letter. And then we asked participants questions, right? We had them make a choice right after they read their letter. So some people got a prior rate increase, and then they either saw a letter that followed the principles or did not. Some people did not get a prior rate increase, and then same thing. And then we asked them to make a choice about their long-term care insurance policy. And then right after they did that, we started asking them a series of survey measures. As I mentioned, we wanted to know, does having a prior rate increase matter? And so one of the things that we can do is look at how does choice vary based on context. Again, we have an experimental design here, so we have a group that was exposed to this and a group that was not. And so you can see here, based on this chart, that those that had received a prior rate increase were more likely to elect to pay the premium increase over those that did not receive that hypothetical scenario. We had a whole host of, just to be clear, I'm only going to show a couple of results here just to kind of exemplify the difference between survey research and experimental research, but there were a whole host of other questions in here. So choice based on the letter. I mentioned that there were two different types of letters. One that we looked at to make sure very carefully that it followed some of these communication principles and guidelines, and one that did not. And we wanted to see, did the letter have any effect? Why I mentioned the other measures is because here you can see there wasn't really an effect for the letter alone. So if we looked at just, if you were in a different condition, right, depending on the letter that you saw, did that have an effect? Well, there wasn't an effect there. But what we did find, because we asked people after they made their choice, well, we asked them questions about perceptions of clarity of the letter. How clear were the RBO choices to you? And going back to those earlier survey questions, right, strongly agree to strongly disagree, we had a series of those types of questions that got at two things that were kind of principal to those checklist items. And that was the idea of tone in the letter and clarity. And what we found later on as we were sort of going through this data experimentally was that tone and clarity mattered. So the letter alone didn't really matter much, but what did matter were perceptions of clarity and tone. And the letter that followed the communication guidelines and principles did score better on perceptions of clarity. So while the letter alone didn't matter, its perceptions of clarity did. The earthquake messaging experiment, so this is kind of the third iteration of the earlier survey data that I was showing you. So the earthquake campaign and the insurance uptake model started out as just survey data. This year we kind of took a different approach, and we wanted to look at whether or not exposing people to different types of messages would increase the likelihood that they would sort of seek out information about earthquake and maybe potentially reach out, right, and have a conversation with someone about earthquake insurance. And so we tested 4 different messages this year. Our goal with the messages was to increase perceptions of susceptibility. We know that based on the literature and the research that currently exists, when people feel that they're more susceptible to a peril, that they're going to be more likely to take action. Whether or not that leads them to buy insurance remains to be seen, but we know that it at least gets them to have the conversations, take more preparedness measures. So this year we wanted to test different types of messages, which one would work best in this scenario. So thinking about earthquake and preparedness for earthquake. So we had a control group, just like our earlier, right, experimental versus control. And then we had 3 different experimental conditions here, so kind of a little bit more complex when it comes to the experimental design. And here we're looking at the differences between these three types of messages: a message that expresses urgency, so it was really about it's time for you to act, you really need to have a conversation with your insurance agent. A message that was centered around fear, so we were trying to scare you. I will let you know here, a little asterisk, when I showed these messages, actually I wasn't in the office on the day that they were shown, but these messages were shown to just my colleagues in a meeting, and they had very strong feelings about the fear appeal and the appropriateness of scaring people when it comes to earthquakes. So I guess it was pretty scary, which is good for us. And then finally, a message about community. Maybe if we sort of tried to motivate people based on this sense of your community needs you, there are things that you could be doing to help your community. We had 1,502 respondents this year for the survey, and we have survey data that we're analyzing now. But to just kind of take a look at one of the results from this survey that kind of, again, gets at this idea of experimental design and what we're able to do with experimental research that we can't do with survey research is we know that our participants were divided between these four conditions. So when it comes to something like susceptibility, that we know we want to increase in order to get people to take action, we can look at which message was more effective. And here you can see, just slightly, right, that urgency message is doing better than the other messages, certainly better than our control message. And that's what we want to see. So that's the work that I've been doing at CIPR, and that's kind of an example of survey research versus experimental research. I'm going to hand it over to Gail now.
First, a little bit, I'm going to talk first a little bit about observational data, and it's sort of the everything else from what Brenda talked about. In particular, it's the non-experimental data. So we're using the term observational data here just very broadly to indicate that it's non-experimental, the researcher is not manipulating anything, and so it's just what occurs naturally. It's just being captured either by us or perhaps we're accessing some sort of data that already exists, but it's just naturally occurring data that's not an experiment. Some common ways that you might see this include things like cross-sectional data, so just a snapshot at a point in time. What is some data, something that's interesting? Perhaps you're gathering other variables as well so that you can kind of slice and dice that and see what kinds of patterns you might see. It could be longitudinal cohort data, so you're there examining the same participants over an extended period of time, and you're taking multiple snapshots or multiple measurements, and you want to look for trends over time there. Often the goal of observational data is simply to see what sorts of associations or correlations you can see in the data. So a lot of times, and my background is in healthcare and health insurance, a lot of times we'll be looking at demographics, we'll be looking at socioeconomic status, we might be looking at family characteristics, health status, things like that. So you'll have a variety of variables like that that exist in the data. And then you'll also be looking at some kind of an outcome, some kind of a result. Perhaps it's how much was spent on health services. And you'd be slicing and dicing by some of those different variables to see what kinds of patterns you can see. So again, often the goal of what you're trying to do with observational data is to find correlations or make predictions. There are times when you can infer causation from observational data, but it needs to be very particular circumstances and very particular methods, because you essentially need to get close to like an experiment. You need to have a control group, you need to have all the variables that you can analyze and separate the effects of things like demographics and socioeconomic status from the result that you're looking at. Fields such as epidemiology, public health, a lot of fields that we're familiar with use largely observational data because there are a lot of situations in which you either would not be able to do an experiment, or sometimes it's even unethical to run an experiment on a group of people. So the sorts of things that we see in the research that we do for the NAIC, there are a lot of different things I'm sure you can think of, examples of observational data that we use either in our research or just in our day-to-day work, from claims data to policyholder data, For healthcare, you could have a lot of data about providers. There's rate data. So a lot of different kinds of data that you can think of are just observational. There was not anything that resulted from an experiment. It's data that already existed. It was captured either by us or by somebody else that has a database that we can access. And the methods, there are a number of methods that are commonly used in observational data. I think a couple of the most common ones are just simply descriptive statistics. So again, looking for those correlations, looking for those patterns in the data. And then a lot of times you'll see different sorts of work we do uses regression. And again, there are a number of other methods as well, but those are probably some of the ones you're most familiar with. And to give you a couple of examples that are using observational data, and you're probably familiar with some of these projects. So the Mississippi Network Adequacy Project had a number of different types of data that are all observational, which is not to say it's not a very complicated project with a lot of different work to do, a lot of different coding, a lot of time it took to figure all this out. But this is all observational data. It started with claims data because we had to figure out the number of visits in the given time period that we were analyzing by different kinds of specialty healthcare providers. Then it went to looking at who are the providers in the network. So there's all the data around that, including their zip codes. And a great deal of analysis and work was done to figure out what the network adequacy results of that would be in terms of how many of the visits would carry a penalty because they were too far away from where the provider and the patient lived, and traveling to the provider was farther away than what the regulation required. So again, that's just an example of where we see an example of observational data. Another one is all the different kinds of reports and work that we do around affordability. So of course that could be in healthcare, it could be in property insurance, it could be in a lot of other areas. But again, this is all observational data. This is not anything that we're doing in an experiment. We are just gathering data that exists and then analyzing it to see what sorts of patterns, what sorts of models, what sorts of information we can come up with to answer the questions that we have about that. The other thing I wanted to talk about is qualitative research, which Brenda again alluded to, and this is a very different area in terms of what the data is that you're working with. So rather than numbers or even survey data where you've got maybe one of 5 choices, if you're doing a survey and asking for people's perspectives or their experience with something or their opinion about something, you might ask them to rank it from 1 to 5, strongly agree to strongly disagree. So that is essentially a quantitative variable. You can deal with that and analyze that like a number. But here with qualitative research, we're talking more about things like interviews, focus groups, free-form responses to survey questions. So it's more of a narrative, and generally what happens is you will have some sort of structured approach that you are using to talk to people, say about their experience with a certain model of healthcare delivery. And you have some questions written out for yourself if you're the interviewer, and you just want to get the person discussing. So you have this discussion, you try to touch on all of these areas that you're interested in as the researcher, and then usually you record that and you transcribe it verbatim, and then you go back and you have a methodology that you apply to pull out the topics. We call this coding, where you identify the themes of what they're talking about. So it's very different to work with this kind of narrative or story or these essentially words instead of the numeric analysis that we might be used to with statistics and regression. Nonetheless, it's a very powerful way of getting information, and sometimes you can learn things and have insights and realize things and realize that there are a lot of nuances to how and why people do things that is much more difficult to capture in quantitative research. So qualitative research generally, I feel like one of the best ways of using it, it's definitely something that's nice to have as an output of something, but I also like it on the beginning, because if you're just starting to wonder how something works or why this is happening, I like to start by just going out and talking to some people, to just starting to get their stories, and you get hints to, you know, what does this mean to them? What might the good research questions be as we go down the road to try and really analyze this? So there's a lot of different ways to use qualitative research. And here on this slide, I have an example for you on a survey that I did that was asking primary care physicians their view of the direct primary care model. So direct primary care is when insurance is not used to pay for primary care. It's paid for directly, oftentimes like a monthly membership, like a gym membership almost. And so the question was posed to physicians, what could be some of the advantages to physicians of this model of practice? And here in the quote bubble is one of the responses that was received. So the idea of coding is to just boil this down to the theme of what this represents. So this one could be boiled down to reduced administrative burden. That would be one of the themes that came out of this particular research. So again, what you would do is you would have your sample of people that you're talking to. You would talk to all of them and try to ask them all the same sorts of questions, get them, you know, touching on all the same topics in your interview, and then you would transcribe all of that and code all of that, and then you would summarize it in some way or have a way to display it for example, on a report or in a article that you want to get published. So this is an example of what that might look like. This particular table is from a different study in which direct primary care was, again, that's one of the things I've studied the most. So I have some examples from that, but this is a survey that was done with direct primary care patients. So people who use that kind of practice that go to a direct primary care doctor and they either pay the DPC monthly fee themselves or perhaps their employer pays it on their behalf as a benefit. And the question was, why did you choose the DPC practice? And so this was in an online survey where that was the last question of the survey, just an open-ended question, and they could type as much as they wanted, or they could leave it blank if they didn't want to give their opinion there. Some people gave just a word or a sentence. Some people wrote an entire paragraph. So that had to then be coded. And in this particular case, because of the format and the type of question we asked, the responses that we got could be coded to multiple things. They could have listed different things. So in this table here, we have 6 different codes: access, financial reasons, quality reasons, insurance, relationship with their physician, and health. And so those are what we ended up with as we worked through all of that data. Those are the codes that we ended up with. And this is the way that this was displayed for this particular report. So we decided to look at it by, to split it by who pays, whether the individual pays themselves or the employer pays on their behalf. And then we also thought it would be interesting to look at the responses and how the responses were coded by the type of coverage they had. Some people were uninsured, some people had employer coverage. We thought we might see differences in their responses and how the themes came out of their answers according to the type of coverage they had. So this is an example of how you might show the results of a qualitative analysis on a report. There are a number of other ways as well, depending on what you're actually looking at. This sort of analysis can be used if you have like a business process you're trying to update or figure out, or perhaps solve some kind of a problem you're having in your business or with some kind of workflow. You could do some qualitative research and just talk to people about what is the process, where is it breaking down, and you could do this sort of qualitative analysis with that kind of data, and it might come back that it is the best to explain it or to display the results of that as a process diagram or some kind of a flow chart or something like that. So this is just one example of what can come from a qualitative analysis. And that is essentially what we had for you.
Nope. So when it comes to qualitative too, I mentioned earlier that the long-term care insurance project that we were working on, that we wanted to gather mixed methods data there. And the end part of that process was we asked people that participated in our survey and our experiment to, if they had long-term care insurance and if they'd be willing to do a follow-up interview. Because as I mentioned, with that experiment, we're trying to replicate the experience of a long-term care insurance policyholder. And we know based on the data that the findings that we have as far as the choice that people are making mirror the choice that other reports have for long-term care insurance policyholders, meaning that, you know, if electing to take the premium increase is the most popular choice that people are making, our data reflected that as well. But in sort of, you know, trying to fabricate this experience, we realized, you know, it'd be good to actually talk to some people that were a part of this experiment and see, you know, people that have long-term care insurance and what their experiences have been. So we also did follow-up interviews in that study. So we have all of this quantitative survey and experimental data that we were then able to couple with this intensive interview data, and it kind of informs the responses. Gail was mentioning earlier that she likes to start sometimes at the qualitative level and then build to quantitative, right? Let the qualitative data kind of inform what you're going to do quantitatively. In this case, we wanted to see if the qualitative data, right, would help to inform the quantitative data that we collected. Because again, I mentioned it's really difficult to find long-term care insurance policyholders. And so we conducted 9 in-depth interviews. We talked to policyholders. I talked to policyholders on the phone for about an hour. I had a series of very structured questions that I walked them through and gave them the opportunity to kind of just elaborate. We talked some about their personal experiences and some about their experience specifically with the letter. If they had received a rate increase letter, I asked them to tell me about that experience in particular. If they hadn't received one, which by the way, all 9 of them had, but if they hadn't, that they could reflect on the letter that they read in the experiment. And that data works really nicely along with the quantitative. So I, you know, said I love experimental research, and I do. I like the idea of controlling something and being able to see what the effect of that is. But I also think there's, you know, a lot of appreciation for the different research approaches and how they kind of complement one another. And oftentimes when you're reading through some of the research reports that are put out by some of these agencies and companies, they're using a lot of mixed method approaches. So they have open-ended questions as part of their survey, or they are conducting in-depth interviews, and it can be really informative.
Yeah, and maybe just to elaborate a little bit more about qualitative and maybe tell a little bit more of a story, because I think we have a fair amount of time left. Earlier in my graduate studies, so my PhD is in health policy and management, which is fairly it includes both quantitative and qualitative in the training, and then you can focus one or the other, or you could focus on mixed methods. And my background before that was all very quantitative. So I'm very comfortable, you know, in spreadsheets and with data models and all those kinds of things. But I was really surprised with how interesting it was to get into some of the qualitative. And one of my first projects was to talk with some patients of direct primary care doctors, and it was just fascinating hearing their stories and really feeling like and realizing as a researcher how much I would be missing if I never learned how to do qualitative, and realized that when you're interviewing someone and giving them a chance to tell you about their family and how they choose healthcare for their family and how much their doctor means to them and some of the stories of things that have happened in their family and how much they appreciated it. And it was just such a rich source of information that you don't get by just numbers in a spreadsheet or doing a survey and having people tell you if they strongly agree to strongly disagree. So I think sometimes we underestimate the power of qualitative, because it's allowing you to have people tell you their stories. And I remember talking with one of the patients of the direct primary care physician in this project that I had in grad school, and he was an older man, so he was on Medicare, and he would just tell me how much he appreciated the fact that he had such great access to his doctor. And he talked about, he said he felt like he was the only patient. Like he had a lot of questions, or he had a lot of different conditions, and questions would come up, and he would just send him an email and he would just, get a response right back. So just how powerful it was, and how much emotionally it meant to people, or helping them take care of their family. So I think as a researcher, it's really helps me realize that there's really rich information available in the qualitative, as well as just all the numbers that are really fun to work in as well.
And just neater. Dealing with qualitative
Yes.
data can get really messy,
Yes.
right? The responses can kind of be all over the map, but you definitely quickly develop, a code book and are able to identify themes. So the goal of today's session was to kind of give you a toolkit, right? So that you could then go out, and when you're interacting with research reports, or again, academic journal articles, and you're reading through those, kind of have a better sense of what you're looking at and how to evaluate the research that you're looking at. So the first slide, when we started out, talked about the difference between research design and research methodology. So you're leaving here today, you understand that there's, quantitative and qualitative research, right? The way that we sort of view data can be in both of those ways, right? It's not all just numbers. It can be very rich qualitative responses as well. We can also take a mixed methods approach, take both of those and put them together, and kind of, either before we do our quantitative work or after, and kind of enhance the quantitative data that we have with the qualitative, or vice versa. Next, we talked a little bit about, I talked a little bit about the idea of research methods. How you collect that data then kind of determines how you can analyze that, and how you can kind of use that data. And so when you're looking through research reports for journal articles, we kind of give you these tools as you work through the article. The first one is, what's the question that they're trying to answer? They may even have hypotheses that they've drawn, right? When you're looking at academic research, oftentimes there are hypotheses attached to the work. We have a lot of existing literature and theory that guide the decisions that we make when we're designing our research. I know for the long-term care project, and even the earthquake project, the more recent iteration of that, where we were testing different messages, we often go to theory and we look at different research studies that have been done and the concepts that they're testing in those relationships. So you want to know what hypotheses do they have, what research questions do they have. And in academic journal articles, you'll see those very clearly. Next, what methods did they use to collect the data? So are they quantitative or qualitative approaches? Because there's different inferences that we can draw based on the type or the method that we're using to collect that data. When you have quantitative data, we can put those into these complex regression models and look at the unique effects of different variables, where with qualitative data, we're having to kind of sit down and code that and look for more rich, in-depth responses. So what methods did they use to collect that data? And I would say, even when you're looking for that, to answer that question within the research article or the report, ask yourself, was that appropriate? I mean, I think even reading through a research report, I think it's fair to say that there's other approaches that could be taken, and what kind of information could you get if you took a different approach? What was the sample size and how was it selected? That really speaks to the generalizability of the results, right? Who did they talk to? Where are these people from? How old are they? Does geographic region matter? Thinking about the earthquake data, right? We were talking to people specifically in the CUSEC region. There could be differences in the way that people in the Midwest perceive an earthquake versus people in California. I'm sure you can kind of glean that on your own, right? When you're in California and you ask people if they think that they're susceptible to an earthquake, well, that's going to be a very different response than when you're asking people in the middle of the country. I can tell you from experience, living here now only 5 years, that there are still people that I encountered that grew up here their entire lives that don't know that there's an earthquake region here. So I think it's important to understand where they're getting that information from, who are the people that they talk to. What is the data source? So Gail talked about observational data and grabbing data from all these different data sources, right? There's lots of really big companies that have very rich databases that researchers can use, and we can get that data and we can do analysis on it. And it matters where you're getting that from. So asking yourself that question, what did they use as their data source? Is this primary data or secondary data? Did someone else collect this, or did they collect it on their own? There's differences there. Was the study funded? I think this is a really important question, and I'm going to give a shout out to our research librarian, or one of our research, man, you have to ask her job title. It's very long, but Erin Campbell helped us out with developing some of these questions, and she brought this up, and I think it's a really important point to ask. Was the research funded, and who paid for the research? Because sometimes that can, imply that there might be findings, or the way that they're presenting those results might be different based on who's the source of the funding for that research. I'm not saying that they did anything. Data is data, right? The answers are within the numbers or even the qualitative responses that you have. But you can present it in different ways to kind of highlight certain things. So knowing the source of funding, or even just looking at the results that they have and kind of comparing what they're saying is important to the stuff maybe that they didn't talk about. And then finally, what method was used to study the data? So again, when we're talking about quantitative data, there's a whole host of methodological approaches that we can use. We can go in and just do kind of very basic descriptive statistics. So here's what this looks like, here's what, the type of people that I surveyed, here's how they answered susceptibility. And then there's complex models that we can build, as I mentioned earlier, where you can look at something like the earthquake data, where you're trying to figure out which of these is the most important and how to express that. So those are kind of the tools that you have to examine research and research reports.
And I would also like to mention that on Thursday afternoon at 4:30, the poster session of I believe we would say it's the CIPR's poster session, which is happening at the office. I'm looking at Erin, it's happening here, sorry. So I would invite you to come and check that out. Some of the research that I had on some of my slides will be in a poster, the DPC study of patients that I had the table in the qualitative slide, the quantitative and qualitative sections of that. I have a poster for that, and certainly you can, welcome, we will both be there. If you have other questions or would like to, talk about our research or talk about the methods or the data, you're certainly welcome to do that. And then we have our takeaways. These were the items that I looked at. I had to sneak a peek at the clock. These were the items that we had as the takeaways or the learning objectives for the session. We do have several minutes. Are there some questions? We do need to use up about 7 more minutes or so. Yes. That's a great question. So let's repeat that for the folks that are watching online, and please jump in if I don't represent your question very well. But his question was around the way you ask a question can a lot of times influence how it is answered, how it's perceived, and that's a really excellent point. And I know in various kinds of research. I'm not sure if it's so much in qualitative in the interview type of style, but a lot of times for various measures, when you have a measure, there's a primary care measure that I'm thinking of in particular where patients are asked particular questions about their experience in primary care, and the way the questions are asked, it has to do with things like, if you had to wait a long time, and things like that to come up with a measure of satisfaction with primary care. And they go through a whole process of validating the measure, and a lot of that has to do with exactly what you're talking about, that the way you phrase a question will influence how people ask it. So there is a whole area of research that kind of supports all that we talked about today that has to do with how you ask the question and understanding people are going to interpret it differently. And even like Brenda was saying, different people in different parts of the country might have a different interpretation. So I think that's one of the things that as researchers we have to be very careful about, is that we want an objective, unbiased result that's meaningful and representative of what we're trying to get to. So if we're not aware of how it can be interpreted differently, that can cause problems with our research.
And I think we take a lot of care and concern in developing the questions specifically for that reason, right? I don't want to prime somebody to have a particular response because, well, a lot of the research in communication, specifically looking at research in persuasion, tells us that even when people don't have attitudes, they have attitudes. So meaning that just me asking you a question about how you feel about something is going to elicit a response in you, even sometimes when you feel very neutral about it. Because the minute that I put you into that survey environment or experiment environment, some people will try to figure out, like, what does she want to know? Or I should have feelings about this. So if I asked you just, walking down the street, what do you think about mustard? You may be like, I never really thought much about mustard. But if I handed you a survey measure and asked you to rate mustard on a scale of 1 to 5, you may have stronger feelings about it because now you're kind of in this environment. So the bias that's inherent in writing questions and the difficulty in not priming people is absolutely something that we take into consideration as researchers. And I think when you're evaluating research on your own and you're looking at how they conducted their research, some reports they'll give you a full appendix of all of the measures that they used, and that's a great question and a great place for people to be looking, right? How did they ask these questions, and could it have in any way influenced the way that people were responding? But I would say a lot of researchers take a lot of time in developing these measures. We think about that a lot when we're evaluating them, but it doesn't mean that sometimes when you're looking at it you could see the potential for that to happen for a particular population. So yeah, something we keep an eye on.
Yes.
Yeah, I just wanted to ask you, Brenda, you mentioned you found something you talked on the phone for an hour. How do you find people that want to spend an hour talking about that? And if so, wouldn't it be biased towards you're finding people that, maybe are retired, have nothing else to do, and that's going to be your whole sample size. So how do you adjust for that?
Yeah, that's a really great question. So how did I find them? Well, I asked them if they had long-term care insurance and if they'd be willing to participate in an interview, and I let them know they'd be incentivized. So we incentivize people to participate. So they received a gift card for meeting with me on the phone for an hour. But I think, there's I read a research article recently about this and like how that biases responses, right? The fact that you're paying people to sit and talk with you. And I would say, sure, there's a chance that that's happening. But a lot of times what we have to do as researchers, and this, I understood it mostly from the quantitative side of work until I started doing more qualitative work, is that sample size matters. So how many people you talk to or how many people you survey determines whether or not you're kind of equalizing things or taking that into account and kind of distributing it so that it's not biasing the results. So meaning there could be someone in there who's answering survey questions in the way that they think that I want them to, but if I've sampled enough people, then I've made sure that that's not going to skew the results one way or the other. So with interviews, incentivizing people to get them on the phone with you is how I was able to do it. And as far as dealing with the fact that, yes, a lot of these people were retired and were more than happy to spend an hour chatting with me, I think that I spoke to enough people that I got what I believe would be the genuine experience of a long-term care insurance policyholder.
And you do have to be careful also, just to go off of what you were saying. As the interviewer, you do have to be very careful to be objective, not to overly respond to something. And if they need to complain or they're venting about something, you just let them do it. As much as you might want to argue or you might want to feel sorry for their situation, you have to kind of just remain very objective and to try not to bias anything further. Did we have another question somewhere? I thought I saw a hand.
Yeah, so how do you find what the right number is? And how do you find the people you're interviewing?
So for the quantitative work that I've done, so thinking about the larger surveys and the experiments, we have an equation that we use in statistics that will help us determine that. So it's really determined by how many questions do I have in there, and then how many conditions do I have, and I'm factoring all of those things in when I'm determining how big the sample should be. When it comes to qualitative data, and I don't know if you have a little bit more insight on that, I have a different approach when it comes to that, but
Yeah, I think for me on qualitative, it's more about having it very well specified in terms of who you're talking to. Sometimes you can get very interesting data qualitatively from a small sample of people that meet a certain criteria. I've been looking at one of the other projects I've been working on lately relates to long-term health effects of natural disasters. And some of those studies were talking to a very small number of people that experienced, maybe it was a tornado or some natural disaster. And so it's sometimes with qualitative, it's not so much about having a large sample size, but it's about talking in depth to, say, 25 people to get the story of what they experienced in that particular situation.
So the answer to that one is kind of, it depends. What the goals are for your research and how many people you think you need to talk to. With the long-term care insurance, I spoke with 12 different people, and 9 of those 12 interviews I felt were usable. And that's because a couple of the folks that I talked to actually did not have, or that I had scheduled with, where didn't actually have traditional long-term care insurance. A lot of people confuse that product with other things. So it was very important to kind of be very clear about what I was looking for.
How do you envision regulators using the end products of your experiments or surveys when they're done and published?
I think one of the areas that I'm interested in, getting regulators interested in, is some of the more unusual or perhaps non-traditional ways of getting access to healthcare, since that's the area of my interest. And I've done a fair amount of work in direct primary care. I've also done some work in health sharing ministries. And I think I would like to bring a different point of view or additional information to regulators about areas they may not necessarily have a lot of information about, and it can maybe broaden their understanding of why people like a health sharing ministry or why people like direct primary care, even though from a regulator standpoint, it might not be as appealing because it's not as much in their area to regulate. And, just like with everything, it's a trade-off between what are the potential downsides if it's less regulated versus what are some of the benefits of the way it can perhaps be more free to do things that make sense in some ways that some other health insurance products are not able to do because of just the structure of the system and the regulatory structure around it.
We're out of time, but I'll answer very quickly, and then I'm happy to talk more. I love talking about research, so if you have other questions, feel free to seek me out. So with the long-term care insurance stuff, I think the big thing, or the big takeaway for me after looking through all of the data that we had, was that there's a lot of confusion. And we know that clarity matters. People are making different decisions based on how clear those letters are. One of the things that we did before we conducted this experiment was evaluate a bunch of different letters. So I think I had 32 in total that would be letters that consumers would receive, and evaluated them just on reading level. I was trying to decide what reading level should I write this at. So I think, using that information to kind of guide how they're evaluating these letters that insurers are writing, and to better help consumers when they're making this choice. They're making different decisions based on that. So it's having an impact. With the earthquake work, hopefully, right, this is showing that different messages are going to affect people in different ways, and that could ultimately result in them reaching out and talking to an insurance agent about insurance or preparing themselves for this particular type of peril. So just kind of the importance of campaigns, campaigns to inform. A lot of that data, and we're looking at data over 3 years now, is showing that there are still a lot of people in the Midwest who don't know that they don't have that kind of coverage. They're not even aware that it's not on their policy, so they may think that they're protected. So I think, just kind of sharing with them that it's important to do awareness campaigns and educational campaigns around different insurance products, and I don't think earthquake is the only one.
Thank you, everyone.